Dear all, Namaste. One of the very common asked question in practicals and to decide in your real life is what is the best timing for treatment of fracture nasal bone or reduction of fracture nasal bone. In this video, I shall be discussing about the best timing and treatment patterns for fracture nasal bone. Let's come to clinical features of fracture nasal bone. The patient presents with some trauma followed by external nasal deformity. Patient may have bleeding from the nose, that is called epistaxis, or bleeding maybe from outside the nose also when there is trauma. Skin over the nose may be lacerated, or there may be edema over the nasal bridge. Edema usually happens within few hours of injury. That is the contraindication for surgery or reduction. There may be periorbital ecchymosis. On touching the nasal bone, there may be pain, and when we move the nasal bone side by side, there may be some form of crepitus, but that is contraindicated to perform when the patient is having acute injury, because otherwise non-displaced nasal bone may be displaced, or patient may develop bleeding, or patient may have CSF rhinorrhea too. So it is better not to perform nasal bone crepitus test when the patient is having acute injury. But when there is obvious deformity, you can just correct it by moving the nasal bone with the thumb and the index finger. Most commonly performed investigation for fracture nasal bone is plain X-ray, soft tissue nasal bone, lateral view. This is very important for your internship. If you are going to the emergency and you see the patient of fracture nasal bone, you have to order for plain X-ray, soft tissue nasal bone, lateral view. When the patient is having polytrauma, then CT scan is performed. CT scan helps to identify fracture nasal bone as well as fracture of the maxillary bone and any problem in the brain. So let's come to our main topic, how to treat, what are the treatment options when to treat the nasal bone fracture. Fractures without displacement do not require treatment. So when there is no displacement, there is no treatment required. In fractures with displacement require close reduction, and sometimes open reduction is required for infection, comminuted fractures, or failed close reduction. There are certain guidelines for treatment of nasal bone fracture. They are: close reduction is done before edema appears, before 3 hours, or after edema subsides after 7 days. As I had discussed in the previous slide, edema of the nose or face is contraindication for close reduction for the nasal bone, because we don't know the exact previous state of the nose, if it was extremely deviated or simple deviation or nothing, by looking on the edematous face. The nasal fracture heals by 2 weeks in adults and 1 week in children. Therefore, close reduction is done before the fracture heals or before there is formation of much callus. When the callus gets fibrosed, then reduction is difficult. When the deformity is healed, that requires rhinoplasty or septorhinoplasty when there is fracture of nasal bone only, or when there is fracture of septum plus nasal bone. Coming to closed reduction, first you should lift the non-depressed nasal bone laterally with Walsam's forceps. Then you have to lift the depressed nasal bone laterally with Walsam's forceps. The point here is, first we have to lift the non-depressed nasal bone because that will be more impacted. So that has to be disimpact, so-called Walsam's disimpaction forceps. Then nasal septal fracture is reduced by lifting it with the as forceps. Now both the nasal bones are brought into midline by firm digital pressure from the outside. Therefore, you should remember that first we have to lift the non-depressed nasal bone, that is opposite side. This is a picture showing close reduction. First you have to lift the non-depressed portion, then depressed portion, then septum and digital pressure. Now let's come to different instruments used for reduction of fracture nasal bone. You must be acquainted with the instruments in the exam. This is the S septum forceps. This Walsam forceps will be right or left side. Okay. This is Boy's elevator, usually used in children to reduce the fracture nasal bone. And this is the nasal speculum. So you have to look on the nose inside of the nasal cavity. The left valsum forceps, right valsum forceps, right-sided. Then as septum forceps, we had already told that the septum also needs to be elevated. First lateral wall, then septum to make it in the midline. In small children, Boy's elevator is used. The Boy's elevator is inserted into the nostril deep to displaced nasal bone. This is important. Blade of the elevator opposes the thumb of surgeon, placed outside the nose. You can see the thumb here. The misaligned bones are to be raised and depressed to their original configuration between the thumb and the elevator. Reduction of the fracture nasal bone with Boy's elevator is used in children. Even while doing lateral and the septal elevation also, while using S and the lateral forceps, you have to always keep your finger in the nasal breeze and in the area of the lateral nasal wall so that there will be no trauma towards the orbit. Orbital trauma has to be avoided and the blades should not go beyond the eyes or beyond the level of the eyes to avoid CSF leak. As I have already told, there may be chance of CSF leak when there is skull base fracture. After completion of the procedure, external splinting is performed to avoid displacement of the nasal bone, fractured nasal bone. Otherwise, if we don't use the splint, then the nasal bone may be displaced again. So there are different techniques of applying the external splintage. Nowadays, we get the ready-made splint so that we can use the splint for 5 to 7 days. When there is comminuted fracture, then we can use lead plate splinting or multiple splints. When the patient has healed fracture nasal bone with external deviation or external displacement or disfigurement, the patient has to undergo rhinoplasty, and this corrects the fracture nasal bone of long duration. If you like my videos, please subscribe my channel Dr. Krishna Koirala for more videos like this. Thank you.